Hi, this is William Huang, and we're now going to talk about the development section of behavioral science. Let's begin with the APGAR score. The APGAR score was devised as a quick assessment of newborn health by Dr. Virginia Apgar. It is a 10-point scale, and it is evaluated at 1 minute and 5 minutes after birth. The APGAR mnemonic stands for appearance, pulse, grimace, activity, and respiration. Each of these parameters is given a score of 0, 1, or 2, where 2 is the best as shown in this table. A cumulative score of 7 or greater is normal, 4 to 6 requires assistance and stimulation, and less than 4 requires resuscitation to prevent long-term neurological damage. Low birth weight for a newborn is defined as a weight less than 2,500 grams. Low birth weight is important because it is associated with higher incidences of physical and emotional problems later in life. Low birth weight is most usually caused by prematurity or intrauterine growth restriction. Risk factors that can lead to low birth weight include poor maternal nutrition, drugs and alcohol, tobacco smoke, and lead exposure. Complications of low birth weight include infections, respiratory distress syndrome, necrotizing enterocolitis, intraventricular hemorrhage, and persistent fetal circulation such as patent ductus arteriosus. Early developmental milestones are high yield for the USMLE. A typical question will give a presentation of a child and ask whether the milestones are appropriate for that age group. Milestones can be divided into motor, social, and verbal/cognitive milestones. Motor milestones in the infant age group include the appearance of the rooting reflex, loss of Moro reflex, and holding the head upright between birth and 3 months, sitting alone and crawling around 7 to 9 months, and walking and loss of Babinski reflex around 15 months. Social milestones in the infant age group include social smile between birth and 3 months, stranger anxiety between 7 and 9 months, and separation anxiety between 12 and 15 months. Cognitive and verbal milestones in the infant age group include orienting and responding to voice by 3 months, responding to name and simple instructions in addition to use of gestures between 7 and 9 months, and a few words by 15 months. For example, at 14 months, a child should be able to walk, have a 4 to 6 word vocabulary, and experience separation anxiety from the primary caregivers. Motor milestones in the toddler age group include climbing stairs between 12 to 24 months, stacking 3 blocks at 1 year, 6 blocks at 2 years, and 9 blocks at 3 years. Between 2 to 3 years, the toddler should be able to feed him or herself with a fork and spoon and kick a ball. Social milestones in the toddler age group include rapprochement, or moving away from and then returning to the primary caregiver between 1 to 2 years, and formation of core gender identity and developing the ability to play in parallel with other children between 2 to 3 years. Cognitive and verbal milestones in the toddler age group include object permanence between 12 to 24 months, 200 words and 2-word sentences at 2 years, and toilet training between 24 and 36 months. As an example, a 2-year-old is expected to speak in short sentences, be almost potty trained, and be able to mimic behavior. Motor milestones in the preschool age group include riding a tricycle, copying lines and circle drawings at age 3, and hopping on 1 foot, using buttons and zippers, self-grooming, and making simple stick figure drawings at age 4. Social milestones in the preschool age group include comfortably spending part of the day away from the primary caregivers at 3 years, and undertaking cooperative play and having imaginary friends by age 4. Verbal and cognitive milestones in the preschool age group include a vocabulary of 900 words and complete sentences by age 3, and the ability to tell detailed stories by age 4. As an example, at 3 years old, a child should be able to play in parallel, speak in complete sentences, copy a simple shape, and ride a tricycle. Many changes occur with aging, and some of these associations may work themselves into a board's question. With regard to sexual function, men begin to have slower erections and ejaculations and a longer refractory period. Women begin to have vaginal shortening, thinning, and dryness due to decreased estrogen production after menopause. Does sexual interest decline with age? No, sexual interest does not decline with age. With aging, REM sleep decreases, slow-wave sleep decreases, and there is an increase in the latency or delay before falling asleep, as well as the number of awakenings per night. With aging, there is a general decrease in the incidence of psychiatric disorders. However, there is an increased suicide rate as people age, and males 65 to 74 years of age have the highest suicide rate in the United States. With age, vision, hearing, the immune response, and bladder control all decrease, as do renal, pulmonary, and GI functioning. Moreover, the amount of muscle mass and heat-generating brown fat decrease while the amount of visceral white fat increases. Of note, intelligence does not decrease with normal aging. Grief is defined as normal bereavement characterized by shock, denial, guilt, and somatic symptoms. Normal grief can last up to 2 months, and patients may experience illusions. Pathological grief can be prolonged grief lasting more than 2 months, excessively intense grief, or grief that is delayed, inhibited, or denied. Patients with pathological grief may suffer from depressive symptoms, delusions, and hallucinations. Do you remember the difference between illusions and hallucinations from the psych lectures? Illusions are misinterpretations of real stimuli, whereas hallucinations are perceptions of non-existent stimuli.